Today we're going to remove the wrinkles from Rafaela's face, and we're going to do that with a product called Dysport. So as I get her ready, I'm going to make her numb first with a little cream. And while I'm getting her ready, I just want to explain the difference between Botox and Dysport. They're both a muscle relaxer. Botox has been around since before the year 2000, and Dysport came in soon after. Botox has been around longer. Dysport is a more modern product. It's a younger product, and I think it's a better product, and I'll tell you why. Dysport is this product right here. Comes in a little bottle like this, and that's the new product, which I'm telling you is better than the old standby Botox. Okay, the reason it's better is because, number one, there's less pain when you inject it, because Botox is more acidic and causes not just the needle pain, but the chemical itself burns once it gets inside, like a bee sting. Whereas Dysport is not as acidic, and you don't have that pain from the injection. Also, Dysport has a more blended, natural look than Botox. And don't forget the bunny lines Rafaela is saying. Also, there's studies showing that Dysport lasts a month longer than Botox. So I really don't see any reason to use.
I have a question.
Yes.
The amount of product that you inject, it have to do with the time lasting, how much it's gonna last?
Yes, like for instance, if you look at Rafaela's face, raise your eyebrows. She's got pretty full, big muscles here, pulling those eyebrows up and making these wrinkles. Smile. You know, that's a pretty big muscle there too. Some people have less. Scrunch here in the middle between your eyebrows now. Make a frown. Yep. Line. So Rafaela has enough muscle mass on her face, a big girl. She needs a double dose. Because if we use just a single dose, which costs more unfortunately because it's half a bottle of the Dysport, not just a quarter bottle. This stuff's very expensive. I wish it wasn't.
The last time I came, I had one dose, so that's why it lasted less.
Right, and the reason it lasts less, because if you don't treat all of the muscle, and if the muscle's bigger, I don't have a very big muscle there, but if it was bigger, it would need a bigger dose. If you treat with less than it needs, then some of the muscle is not treated. And when the muscles, the part of the muscle that's not treated will take over the function for the relaxed muscle. And therefore, your lines will come back faster. Oh. So please try to listen to me when I tell you need a double dose, I'm sorry to say. And if it makes any of you feel better, I need a triple dose. Now, if you keep up your treatment with Botox every 4 months and with Dysport every 5 months, you may need less. Because as you keep up the treatment, your muscle will shrink, and it will need less. Now, if you let the Botox or the Dysport go for 6, 7 months, the muscle starts working again, getting stronger, getting bigger, and you're going to need the double dose again. So raise your eyebrows. See, her lines are only at the top. Some people have all across, and you need more.
Let me ask you something. There are some doctors that they point with the pen. Why don't you do that?
If a doctor puts marks on your face, that means he really doesn't have very much experience. I did that back in school. And not only that, if you put a pen on there, you can make a tattoo if you pierce through the pigment. And also, it can be germy, because who knows who else they use that marker on. Okay. Watch, and you'll see that you do not need a marker, because her own face is the best marker. Raise your eyebrows. I see the lines here. I'm visualizing the muscle underneath that's causing those lines, and I know that I have to put these lines, these marks. Relax, and I'm going to do it symmetrically. I'm going to go this side, and I'm going to do the exact same thing on this side. I do it quick because I know what I'm doing. Now, raise your eyebrows again. We have to quiet down this section too. Relax. You always want to be relaxed when you do this, because otherwise you can push the medicine out with your muscle. Raise again. Okay, good. So she just needs just a little bit more here and here to get the smoothest result. Now we're going to go raise one more time. I just want to take a look. Okay, see, this is smooth here. So let's work on between between the eyebrows. That area is called the glabella. There's two muscles there. One that creates the horizontal line. That muscle is called the procerus, and that goes from the nose up to the top of the brow. And then there's a pair of muscles called the corrugators, and they make the vertical lines, or the 11. Some people call them hatchet marks, some people say. Now we're going to go for the procerus muscle. Make them, see, now that's creating these horizontal lines, which are not as big as her. Okay, relax. We always relax during the treatment, right down into the muscle. Some doctors go very superficial, but the Botox loses a little power when you do that, because then it has to drift from just under the skin all the way down into the muscle. So I really like to put it right in the muscle so it's most effective. Now squint again, and you can see this muscle that goes from here to here causing these lines. I'm going to just hold this up. I have the muscle in between my fingers. I only want to do the top part of the muscle, otherwise it can drift down into the eyelid. And if it does that, you can have trouble opening your eye. Now we're going to do the other side. There's the muscle between my fingers. Right in there, one poke, and I'm right on the muscle. I'm going to put the medicine in there, and that's it. And one thing I do that a lot of people don't do is I do a little massage, because you can see the bump, that's the medicine, but the muscle's long, so I want to make sure this just doesn't drift wherever it wants. I'm going to move that bump of fluid and spread it evenly over the muscle. Again, making it more effective and safer. And I want to do that on the forehead too, just to try to distribute the medicine along the muscle. All the muscles are flat and wide. Sorry. Okay. If I seem rough, it's because I have to be.
Okay.
You need to put a certain amount of pressure to make this work. But the ice does two things. It makes it more numb, and so it doesn't hurt, but it also causes the vessels to shrink, called vasoconstriction, so less chance of a bruise.
No.
Okay, so even if you use numbing cream like she did, the ice can still help. So ice this. Can you hold that there?
Sure.
All right, we're going to come across here. We're going to alcohol this area. And I'm going to start injecting her crow's feet. Big smile. Starting up here, relax. I'm going to stretch the skin. You can see some veins. Bruising can happen here no matter how careful I am, because once you stick that needle in, all these vessels that you can see have little branches that you can't see. And if you hit one of them, you're going to get a little bruise. Okay, smile and relax. And also, you go to some doctors and they make you sit up for this.
That's not good, right?
Well, I know that's a very old-fashioned rule that Botox made when it first came out 20 years ago. That, oh my God, don't lay down. Oh my God, it's going to drift someplace funny. So if you're, let's think about that. So if you're sitting up and it's going to drift, and it drifts down into your eye, that's bad. So laying back, if it's going to drift, and it's not going to drift this quick, it takes time, and plus I massage it to direct it where I want it, this will drift away from the eyes. So doesn't it make more sense to do it this way?
Yeah.
Plus you're more comfortable, you're not sitting up, getting someone put like a darts in your face. And the other thing I didn't say about Dysport is it starts working in 24 hours. Botox takes 3 days before the first sign of any relaxation starts. So it works faster.
Okay.
But with both the products, the full effect is not till 2 weeks. And you can expect it to take a hold gradually, but not always evenly. So if you don't like the result within the first 2 weeks, try to be patient. In 99.9% of the cases, you won't need a touch-up if you've done the right amount. Just wait the 2 weeks and see. And if you still have a problem, if one eyebrow's higher than the other after 2 weeks, come see me, and just one drop can drop it back down. Before 2 weeks, you may have one high. It's upsetting, but don't worry, it usually evens out. Just watch it. Okay? So you're finished.
Thank you so much, Dr. Warfel.